Which of the following atypical antipsychotic medications has U.S. Food and Drug Administration approval for treatment of bipolar depression when combined with fluoxetine, Prozac? A. Quetiapine, Seroquel. B. Olanzapine, Zyprexa. C. Risperidone, Risperdal. D. Aripiprazole, Abilify. The correct answer is B. Olanzapine, Zyprexa. Olanzapine in combination with fluoxetine, Symbyax, is FDA approved for the treatment of bipolar depression. Which laboratory test should be ordered to rule out a medical cause of dementia symptoms? A. Vitamin D3. B. Thiamine. C. Albumin. D. Vitamin B12. The correct answer is D. Vitamin B12. Low vitamin B12 levels have been associated with the development of dementia-like symptoms, and when dementia is a differential diagnosis, a vitamin B12 level should be checked. A patient presents for a clinic appointment and tells the psychiatric mental health nurse practitioner, PMHNP, "My depression is a little better, but I read about acupuncture, and I want to add this to my treatment." What is the PMHNP's best response to this patient? A. Acupuncture has been found to help some individuals with depression. While the data is limited, if this is something you would like to consider, let's talk about where you might find a reputable practitioner for acupuncture treatments. B. Integrative therapies such as acupuncture are not well studied, and I cannot recommend that you add this to your current treatment. C. Acupuncture is one of many integrative therapies, but it has the least effectiveness in improving depression. D. Integrative therapies have no effectiveness in improving depressive symptoms, and if your depression has not improved and you have not achieved remission of your symptoms, I recommend that we increase your antidepressant. The correct answer is A. Acupuncture has been found to help some individuals with depression. While the data is limited, if this is something you would like to consider, let's talk about where you might find a reputable practitioner for acupuncture treatments. Research studies involving administering acupuncture for the treatment of depression show that when combined with medication, acupuncture can be beneficial. Following client-centered therapy, if the patient is requesting acupuncture, the PMHNP should assist the patient in investigation of this treatment. In managing the maintenance phase for bipolar I disorder, which of the following statements is not supported by current evidence in the literature? A. Lithium, but not lamotrigine, is superior to placebo in preventing a manic, hypomanic, or mixed episode. B. Lamotrigine, but not lithium, is superior to placebo in preventing a depressive episode. C. Extended-release formulation of carbamazepine is equivalent to lithium in preventing a manic, hypomanic, or mixed episode. D. Both lamotrigine and lithium are superior to placebo in delaying onset of mood-related episodes. The correct answer is C. Extended-release formulation of carbamazepine is equivalent to lithium in preventing a manic, hypomanic, or mixed episode. Extended-release formulation carbamazepine has demonstrated preliminary efficacy in the treatment of acute manic or mixed episodes, but it is not currently indicated in maintenance phase of treatment for bipolar I disorder. Side effects included dizziness, somnolence, nausea, vomiting, ataxia, blurred vision, dyspepsia, dry mouth, pruritus, and speech disorder. The other 3 responses are supported by current evidence in the literature. Your 37-year-old female patient suffers from schizophrenia. She has been maintained in stable condition for 4 years on quetiapine, Seroquel. She tells you that her gynecologist has recommended that she have a total hysterectomy. You asked her if her gynecologist plans to prescribe hormone replacement after the total hysterectomy. She responds no. You initiate a call to the gynecologist to discuss hormone replacement therapy. A. Consultation with the gynecologist is not needed. The hyperprolactinemia caused by the antipsychotic, quetiapine, has already reduced estrogen production in the patient's body to a point where it is not an issue after 4 years on the medication. B. You want to know if the gynecologist will wean the patient off her own estrogen. By suppressing the ovaries, she can be tapered off her own estrogen before the surgery. C. Consultation with the gynecologist is not needed. The patient can adapt to surgical menopause as easily as she would natural menopause. Estrogen waxes and wanes in the body naturally and plays no part in schizophrenia. D. The abrupt loss of estrogen from the ovaries can precipitate deterioration of mental state, hallucinations, delusions, and depression. The correct answer is D. The abrupt loss of estrogen from the ovaries can precipitate deterioration of mental state, hallucinations, delusions, and depression. Estrogen therapy can help keep the patient in a stable mental state. Estrogen exerts neuroprotection to the brain cells. It is one of the best antidepressants. Estrogen stimulates an increase in 5-HT2A receptor density and the serotonin transporter. This mechanism is thought to mediate mental state, mood, cognition, memory, emotions, and neuroendocrine control. In distinguishing borderline personality disorder from chronic post-traumatic stress disorder related to childhood sexual abuse and victimization, which of the following would be more indicative of borderline personality disorder? A. Irritability or intense outbursts of anger. B. Efforts to avoid real or imagined abandonment. C. Affect lability, often associated with intense fear. D. Feeling of detachment or estrangement from others. The correct answer is B. Efforts to avoid real or imagined abandonment. Borderline personality disorder is characterized by frantic efforts to avoid abandonment and unstable interpersonal relationships characterized by idealization and evaluation, which can lead to affectability, fear, irritability, anger, and detachment or estrangement. Which of the following antipsychotic medications has dosage formulations which include oral tablets, orally disintegrating tablets, short-acting injections, and long-acting injections? A. Paliperidone, Invega. B. Clozapine, Clozaril. C. Ziprasidone, Geodon. D. Olanzapine, Zyprexa. The correct answer is D. Olanzapine, Zyprexa. Olanzapine is available in various formulations. Clozaril is only available in oral tablets, orally disintegrating tablets, and oral suspension. Paliperidone is only available in oral tablets and long-acting injections. Ziprasidone is only available in capsules and a short-acting injection. A 33-year-old female patient has been diagnosed with bipolar disorder. Before starting this patient on lithium, Escalith, for mood stabilization, Which of the following laboratory tests are appropriate to obtain for this patient? A. Thyroid function tests, liver function tests, pregnancy test. B. Thyroid function tests, creatinine, complete blood count. C. Thyroid function tests, creatinine, pregnancy test. D. Thyroid function tests, creatinine, liver function tests. The correct answer is C. Thyroid function tests, creatinine, pregnancy test. Lithium has a low margin of safety, making frequent monitoring necessary. Common side effects include gastrointestinal disturbances, nephrotoxicity, hypothyroidism, tremors, leukocytosis, acne, psoriasis flares, hair loss, and edema. It is important to get thyroid function tests and renal function tests before starting lithium therapy. A middle school boy repeatedly lies, steals, bullies peers, instigates fights, and inflicts harm without feeling any regret or remorse. These are characteristic of which disorder? A. Antisocial personality disorder. B. Oppositional defiant disorder. C. Conduct disorder. D. Disruptive behavior disorder. The correct answer is C. Conduct disorder. Conduct disorder is a childhood disorder characterized by serious violations of social norms, including aggressive behavior, destruction of property, and cruelty to animals. These children often lie to achieve short-term ends, may be truant from school, run away from home, and may engage in petty larceny or other delinquent behaviors. Which of the following interventions does not have evidence-based findings that demonstrate reduced symptoms in individuals with non-combat related post-traumatic stress disorder, PTSD? A. Anticonvulsants. B. Selective serotonin reuptake inhibitors, SSRIs. C. Eye movement, desensitization, and reprocessing, EMDR. D. Exposure-based cognitive behavioral therapy, CBT. The correct answer is A. Anticonvulsants. Randomized placebo-controlled clinical trials have not demonstrated efficacy or PTSD symptom improvement by anticonvulsants. SSRIs are evidence-based pharmacologic interventions for PTSD. EMDR and exposure-based CBT demonstrate the best evidence among non-pharmacologic interventions. When suspecting a patient has neuroleptic malignant syndrome, NMS, which laboratory values would help confirm the diagnosis? A. Leukocytosis and elevated creatine phosphokinase. B. Leukocytosis and thrombocytopenia. C. Leukopenia and decreased creatine phosphokinase. D. Leukocytosis and thrombocytosis. The correct answer is A. Leukocytosis and elevated creatine phosphokinase. With NMS, a patient has an elevated creatine phosphokinase, CPK, due to skeletal muscle breakdown and an elevated white blood cell count. A patient with a diagnosis of schizophrenia has a history of suicidal ideation and suicide attempts. The psychiatric mental health nurse practitioner should consider which antipsychotic medication that is the only known antipsychotic to reduce the risk of suicide in schizophrenia. A. Clozaril, Clozapine. B. Invega, iloperidone. C. Abilify, aripiprazole. D. Latuda, lurasidone. The correct answer is A. Clozaril, Clozapine. Clozaril, Clozapine, is the only known antipsychotic medication that has been shown to reduce the risk of suicide in patients diagnosed with schizophrenia. In the American Journal of Psychiatry, you read an article that discusses a recent study's evidence that the nicotine exposure in pregnant women increases the risk for schizophrenia in offspring, that is, 38% increased likelihood of schizophrenia in young adults whose mothers smoked heavily while pregnant. This inspires you to translate this information in practice and teaching roles as a nurse practitioner. What considerations are needed to practice based on the best evidence? A. Determine if any other psychiatric or medical journal articles have commented on the validity or generalizability of the original study. B. If the research is published in a peer-reviewed journal, such as the American Journal of Psychiatry, it is sound research. C. Analyze the original study only to determine that the research is sound and meets the criteria for effectiveness of an intervention. D. Analyze the original and repeat studies for methodical rigor and verify that there were randomized or non-randomized clinical trials with the same results. The correct answer is D. Analyze the original and repeat studies for methodical rigor and verify that there were randomized or non-randomized clinical trials with the same results. Research utilization begins with the idea of putting an innovation to use in practice. The level of the evidence must be considered. The best of the best evidence comes from reviewing several randomized, clinical trials of the same thing with the same results. Second to that are several non-randomized trials about the same thing with the same results. Single randomized or non-randomized trials make up Level 2 evidence regarding the effectiveness of an intervention. Which of the following lab findings would raise the greatest concern when prescribing lithium? A. Serum sodium ion, 120 milliequivalent per liter. B. Glomerular filtration rate, GFR, 115 milliliters per minute. C. Blood urea nitrogen, BUN, 20 milligrams per deciliter. D. Serum creatinine, 3.0 milligrams per deciliter. The correct answer is D. Serum creatinine, 3.0 milligrams per deciliter. Normal serum creatinine is 1.5 milligrams per deciliter. Elevated creatinine indicates decreased renal function. Lithium is excreted through the kidneys and decreased renal function can result in lithium toxicity. In distinguishing between cortical and subcortical dementias, which of the following findings would be indicative of subcortical dementia? A. Late dysarthria. B. Euthymic mood. C. Early aphasia. D. Early gait disturbance. The correct answer is D. Early gait disturbance. Both cortical and subcortical dementia are characterized by impaired recall and recognition, impaired attention and immediate recall, impaired abstraction, and impaired visuospatial skills. Subcortical dementia is a clinical syndrome characterized by slowness of mental processing, forgetfulness, impaired cognition, apathy, and depression. Mr. Jones, a 78-year-old male patient, presents to the psychiatric mental health nurse practitioner for a follow-up medication appointment. Mr. Jones' depression has been successfully treated with citalopram 20 mg by mouth daily. During the visit, Mr. Jones complains that in the last 2 or 3 weeks, he has had nausea, fatigue, feeling weak, with a headache and decreased appetite. Which action would be the most appropriate for Mr. Jones? A. Assess for other symptoms of hyponatremia and check a serum sodium level. B. discuss rates of relapse on a selective serotonin reuptake inhibitor and increase his medication to citalopram 40 mg by mouth daily. C. Discuss rates of relapse on a selective serotonin reuptake inhibitor and recommend switching his medication to a different antidepressant class. D. Discuss selective serotonin reuptake inhibitor discontinuation syndrome and stress the importance of medication adherence. The correct answer is A. Assess for other symptoms of hyponatremia and check a serum sodium level. Hyponatremia can occur on selective serotonin reuptake inhibitors and is more common in elderly patients. This patient is reporting symptoms of moderate hyponatremia and needs to be assessed, and his sodium level needs to be checked. When evaluating a woman with major depressive disorder, which of the following would not be a major consideration in the differential diagnosis? A. Prior episodes of depression. B. Any episodes of hypomania. C. Prior pregnancies. D. Any periods without sleep yet no fatigue. The correct answer is C. Prior pregnancies. The primary concern is to rule out bipolar disorder when making a diagnosis of major depressive disorder. Prior episodes of mania, hypomania, and extended periods of fatigue are indicative, as well as prior episodes of depression, mood swings, and chronic irritability. Prior pregnancies are not relevant, but postpartum depression is. Clozapine is associated with severe neutropenia. The requirements to prescribe, dispense, and receive clozapine are incorporated into a single, shared program called the Clozapine Risk Evaluation and Mitigation Strategy, REMS. Who implements the Clozapine Risk Evaluation and Mitigation Strategy, REMS? A. Centers for Disease Control and Prevention, CDC. B. A Federal Drug Administration, FDA. C. The manufacturers of clozapine, Clozaril. D. Health and Human Services, HHS. The correct answer is C. The manufacturers of clozapine, Clozaril. REMS is a strategy to manage known or potential risks associated with a drug or group of drugs, and is required by the FDA for clozapine to ensure the benefits of the drug outweigh the risk of severe neutropenia. Which of the following findings would raise concern in an annual exam of a 76-year-old woman? A. Fasting glucose 76 mg per deciliter, Hg 11.8 grams per deciliter, HCT 38%. B. Blood pressure 130/86, pulse 82, respirations 25. C. Height 65 inches, weight 140 pounds. D. AST 85 units per liter, ALT 45 units per liter. The correct answer is D. AST 85 units per liter, ALT 45 units per liter. Height, weight, calculated BMI of 23, all vital signs, glucose, hemoglobin and hematocrit are within normal limits for 76-year-old woman. The AST is elevated, normal range 5 to 40 units per liter of serum, and ALT is normal, range 7 to 56 units per liter of serum. When AST is greater than ALT, one suspects chronic liver disease or recent post-myocardial infarction. Further assessment is warranted, including ruling out of alcohol dependence. When counseling a 52-year-old perimenopausal woman with nocturnal hot flashes, anxiety, depressed mood, low energy, little motivation, diminished sex drive, and work-related stress, What lifestyle changes and complementary therapies would be evidence-based recommendations to consider when this patient does not want to be on hormone replacement or antidepressant medication? A. Walking, St. John's wort, and black cohosh. B. Yoga, isoflavonoids, and black cohosh. C. Current evidence does not support the efficacy of complementary therapies for perimenopausal or depressive symptoms. D. Tai Chi, dietary soy, and flaxseed. The correct answer is D. Tai Chi, dietary soy, and flaxseed. The National Center for Complementary and Alternative Medicine, NCCAM, suggests that additional research is needed before Tai Chi can be widely recommended as an effective therapy. A WBC of 4,000 in a patient taking clozapine would prompt the psychiatric mental health nurse practitioner to take which of the following actions? A. Consult with hematologist to determine appropriate antibiotic regimen and monitor closely. B. Discontinue clozapine, initiate alternative antipsychotic medication and monitor closely. C. Institute daily complete blood count with differentials and monitor closely. D. Institute twice weekly complete blood count with differentials and monitor closely. The correct answer is D. Institute twice weekly complete blood count with differentials and monitor closely. The recommended cut points for discontinuation of clozapine are WBC of 2,000 to 3,000 or granulocytes of 1,000 to 1,500 for agranulocytosis and severely compromised immune system. The psychiatric mental health nurse practitioner treating a patient for schizophrenia on ziprasidone orders an electrocardiogram. Which QTc interval result places the patient at greatest risk for torsades de pointes? A. 500 to 700 milliseconds. B. 300 to 500 milliseconds. C. 100 to 200 milliseconds. D. 160 to 260 milliseconds. The correct answer is A. 500 to 700 milliseconds. A patient with a QTc interval of 500 to 700 milliseconds is at higher risk of developing torsades de pointes. Following best practice guidelines, which pharmacologic and non-pharmacologic treatments are the best studied and have the highest level of evidence for the treatment of nightmares in adults with post-traumatic stress disorder, PTSD? A. Clonidine, Catapress, and progressive muscle relaxation. B. Quetiapine, Seroquel, and eye movement desensitization and reprocessing, EMDR. C. Prazosin, Minipress, and image rehearsal therapy. D. Venlafaxine, Effexor, and hypnosis. The correct answer is C. Prazosin, Minipress, and image rehearsal therapy. Image rehearsal therapy and prazosin are the best studied and have the highest level of evidence for the treatment of nightmares in adults with PTSD. An 88-year-old nursing home patient presents to the emergency department with recent mental status changes, including aggression, confusion, and dizziness, over the past 2 days. The patient scored a 20 on the Mini Mental Status Exam, MMSE. In addition to the MMSE, what additional information is needed to complete a thorough evaluation? A. Electrocardiography and pharmacogenomics testing. B. Blood chemistry, complete blood count, and urinalysis. C. Hamilton Depression Scale score. D. Patient Health Questionnaire score. The correct answer is B. Blood chemistry, complete blood count, and urinalysis. A bedside MMSE can be used to document the cognitive impairment and to provide a baseline from which to measure the patient's clinical course. In distinguishing HIV-related depression from HIV dementia, which of the following findings would be indicative of HIV dementia? A. Apathy and inertia. B. Decreased motivation. C. Diminished attention and concentration. D. Incoordination. The correct answer is D. Incoordination. Acquired abnormality in motor function verified by clinical examination, for example, slowed rapid movements, abnormal gait, incoordination, hyperreflexia, hypertonia, or weakness, is indicative of HIV dementia, but not HIV-related depression. Apathy, inertia, decreased motivation, diminished attention and concentration are clinical symptoms that can be present in both depression and dementia. Making an evidence-based decision regarding implementation of an intervention includes current research evidence and all of the following except the A. Patient's clinical status, circumstances, and preferences. B. Generalizability of findings. C. Availability of healthcare resources. D. Clinician's expertise. The correct answer is B. Generalizability of findings. Generalizability refers to a particular study's findings and to what extent those findings are applicable to patients in other practice settings. The other responses, along with current research evidence, comprise the four domains of evidence-based decision-making and practice. Risk reduction for a 22-year-old patient with schizophrenia taking olanzapine includes patient education on daily exercise, balanced nutrition, and baseline and periodic monitoring of BP, weight, BMI, and A. Fasting glucose, fasting lipid panel, electrolytes. B. Waist circumference, fasting glucose, fasting lipid panel. C. Fasting lipid panel, EKG, liver enzymes. D. Waist circumference, fasting lipid panel, EKG, prolactin level. The correct answer is B. Waist circumference, fasting glucose, fasting lipid panel. All atypical antipsychotics pose risk for weight gain and require baseline and periodic monitoring for BP, weight, BMI, waist circumference, fasting glucose, and fasting lipid panel. Monitoring key indicators is intended to reduce the risk of medication-induced weight gain, metabolic syndrome, dyslipidemia, and diabetes mellitus. A psychiatric mental health nurse practitioner treating a 32-year-old woman after hospitalization for postpartum psychosis after the birth of her first child needs to consider which is the most important risk factor when monitoring her response to treatment. A. As many as 2/3 of patients have a second episode of an underlying affective disorder during the year after the baby's birth. B. Subsequent pregnancies are associated with increased risk of another episode, as high as 50%. C. Incidence of postpartum psychosis is about 1 to 2 per 1,000 childbirths, and 50 to 60% of affected women have just had their first child. D. Data suggest that an episode of postpartum psychosis is essentially an episode of a mood disorder, and is usually an indicator of bipolar disorder. The correct answer is D. Data suggest that an episode of postpartum psychosis is essentially an episode of a mood disorder, and is usually an indicator of bipolar disorder. All of these statements are true. However, after the initial resolution of psychosis, subsequent monitoring for symptoms of bipolar disorder versus depressive disorder is essential. Risk for bipolar disorder and symptom relapse poses greater risk than major depressive disorder alone. Education about risk for postpartum psychosis in subsequent pregnancies is secondary concern. Sally is a 27-year-old attorney who recently moved to your area. Sally presents with social anxiety disorder, specifically symptoms of performance anxiety. Sally's only other medical condition is exercise-induced asthma, and she is treated on albuterol. Sally states she was in cognitive behavioral therapy, CBT, without relief, and would like to try a medication. Which is the most suitable initial treatment for Sally? A. Sertraline, Zoloft. B. Clonazepam, Klonopin. C. Inderal, Propranolol. D. Risperidone, Risperdal. The correct answer is A. Sertraline, Zoloft. Zoloft is used to treat social anxiety disorder, and the patient is on albuterol. Therefore, the beta blocker Inderal is contraindicated with albuterol due to the risk of increased CNS stimulation. You have a 16-year-old patient who suffers from binge eating disorder. She is 5 foot 10 inches tall and has a BMI of 30. You consult the National Guideline Clearinghouse for the best information on treating the patient. Part of your treatment plan includes A. Use of sibutramine, Meridia, 10 mg orally every morning and a reduced calorie diet. It is associated with significant weight loss. B. Implementing non-diet health at every size therapy in addition to psychotherapy to help with weight stabilization and binge eating. C. Urine-specific gravity, orthostatic vital signs, and oral temperatures taken on a regular basis. D. Treatment with duloxetine, Cymbalta, long-term at low dose and a reduced calorie diet. It is associated with significant weight loss. The correct answer is B. Implementing non-diet health at every size therapy in addition to psychotherapy to help with weight stabilization and binge eating. Non-diet health refers to therapy that looks at eating a healthy diet at the weight you are currently occupying. It does not use restriction dieting to reduce weight, but rather seeks to teach good food habits and normal eating at the weight the patient occupies. Sibutramine was voluntarily removed from the U.S. formulary due to cardiac problems in 2010. Checking urine-specific gravity is a treatment for bulimia nervosa due to electrolyte problems with constant vomiting. SSRIs are used in high dosage for short timeframes in the treatment of binge eating disorder and are a Level 2 guideline. Lorazepam is the preferred benzodiazepine when managing alcohol withdrawal symptoms in a patient with comorbid A. Folate deficiency anemia. B. Seizure disorder. C. Hepatic disease. D. OxyContin abuse. The correct answer is C. Hepatic disease. Benzodiazepines have long been used to treat alcohol withdrawal symptoms. Recommended guidelines use diazepoxide, Librium, or diazepam, Valium, agents with a long half-life, in patients with adequate hepatic or liver function. However, in patients with compromised hepatic function, a benzodiazepine with short half-life, such as lorazepam, is recommended to reduce risk of toxicity and further liver damage. An 8-year-old boy is referred to you by his school nurse because he has been complaining of stomach aches every morning in school for the past month. When interviewing the boy's mother, she states that he does not like to go to school, insists on coming home immediately after school, and sleeps with his parents at night. The mother denies any other complaints. Which of the following is the most likely diagnosis? A. Reactive attachment disorder. B. Post-traumatic stress disorder. C. Separation anxiety disorder. D. Social phobia. The correct answer is C. Separation anxiety disorder. His behaviors and symptoms are most consistent with separation anxiety disorder, characterized by developmentally inappropriate and excessive anxiety concerning separation from the home or from those to whom the individual is attached. Consistent with this diagnosis, he does not like to go to school, comes home immediately after school, sleeps in his parents' bed at night, and has repeated physical symptoms at school. Which of the following is not characteristic of individuals with antisocial personality disorder, APD? A. APD is strongly associated with alcohol and drug abuse. B. APD is 5 times more common in first-degree biologic relatives for men. C. APD is correlated with low dopamine levels in the frontal cortex implicated in aggression and impulsivity. D. APD is identified predominantly in European and Western industrialized countries. The correct answer is D. APD is identified predominantly in European and Western industrialized countries. People with APD or psychopathic personalities are found in many cultures, including industrialized and non-industrialized societies. Examples include the Inuits of Northwest Alaska, the Yorubas in Nigeria, and villages in China. Your patient suffers from insomnia and bipolar disorder. She tells you that she likes to take her lurasidone 20 mg, Latuda, at bedtime because it is easier for her to remember. She does not like to gain weight, so she eats 2 90-calorie packages of ham slices with the lurasidone before she goes to bed. She complains of not being able to go to sleep very quickly. You respond: A. Improve your sleep hygiene, and continue to eat the ham at bedtime. B. I recommend that you take in 360 calories of carbohydrate at bedtime to induce sleepiness. C. Increase the ham so that you are taking in 360 calories for full absorption. D. I will increase the lurasidone dosage to 40 mg at bedtime to increase the soporific component. The correct answer is B. I recommend that you take in 360 calories of carbohydrate at bedtime to induce sleepiness. You must eat 360 calories of food to get proper absorption of lurasidone, Latuda. If you do not, you only get 1/2 of the medication absorbed into the body. In addition, protein tends to awaken people while carbohydrates tends to make them sleepier. Turkey is the exception because it contains tryptophan. A 34-year-old African-American female presents for an initial psychiatric evaluation. On examination, she reports she thinks she has attention deficit disorder because she has a short attention span, poor recent memory, nervousness, and mood lability, and she is sweating more. Which laboratory test should the psychiatric mental health nurse practitioner order to rule out an organic etiology of her symptoms? A. Thyroid profile. B. Prolactin level. C. Comprehensive metabolic panel. D. Cortisol level. The correct answer is A. Thyroid profile. A patient presenting with nervousness, problems with memory, focus, mood lability, and sweating should be tested for hyperthyroidism before being diagnosed with a psychiatric disorder. Electroconvulsive therapy, ECT, is a treatment for depression. What adverse effect is uncommon for a patient to experience after receiving ECT treatments? A. Muscle soreness. B. Headaches. C. Memory disturbance. D. Fractures. The correct answer is D. Fractures. Headaches, memory disturbance, and muscle soreness are common immediately after ECT treatment. In bipolar I disorder, men are more prone than women to have A. Manic episodes. B. Depressive episodes. C. Rapid cycling. D. Mixed episodes. The correct answer is A. Manic episodes. In bipolar I disorder, manic episodes are more common in men, and depressive episodes are more common in women. When manic episodes do occur in women, they are more likely than men to present a mixed picture, for example, mania and depression. Women also have a higher rate of being rapid cyclers, defined as having 4 or more manic episodes in a 1-year period. A client says that because he wished his sister was dead, and your client's sister subsequently was killed in a motor vehicle accident, the death was caused by the client's wishes. The client also revealed that he can read others' minds. This client is most likely suffering from which personality disorder? A. Paranoid personality disorder. B. Delusional personality disorder. C. Schizotypal personality disorder. D. Schizoid personality disorder. The correct answer is C. Schizotypal personality disorder. Schizotypal personality disorder is characterized by ideas of reference and magical thinking. A 20-year-old male with no previous psychiatric history arrives at the emergency room with his college roommate. The roommate reports that the patient has been acting erratic for the past month, talking to people who do not exist, walking around naked, and accusing the roommate of spying on him. The patient's vital signs are within normal limits, and his neurological examination does not show any abnormalities. The most appropriate laboratory test would be which of the following? A. Toxicology test. B. Non-contrast CT scan of the brain. C. Complete blood count. D. Liver function tests. The correct answer is A. Toxicology test. The key points with this patient are the absence of a previous psychiatric history and the duration of symptoms. Before diagnosing a mental illness, it is necessary to rule out the effects of a substance. Which of the following interventions have evidence-based findings to reduce comorbid substance use in patients with schizophrenia? A. Voucher-based behavioral reinforcement. B. 3-session individual motivational enhancement. C. Manualized group intervention with motivational enhancement. D. Psychosocial support group targeting coping skills. The correct answer is C. Manualized group intervention with motivational enhancement. Manualized group intervention with motivational enhancement to reduce substance use has demonstrated efficacy. The other approach have less evidence to support efficacy in reducing substance use in patients with schizophrenia. When evaluating a 5-year-old child with language deficits, which of the following is a key indicator in differentiating autistic disorder from a mixed receptive expressive language disorder? A. Language abnormalities such as echolalia are common. B. Imaginative play is predominant form of expression. C. Level of intelligence ranges from mild to severe impairment. D. Family history of speech delay or language problems. The correct answer is A. Language abnormalities such as echolalia are common. Language abnormalities such as echolalia and stereotyped phrases are more common in autistic disorders than in mixed receptive expressive language disorders. 25% of cases have a family history of speech delays or language problems. Intelligence levels can range from mild to severe, with more severe impairment occurring more often. For a patient who has a long history of opiate dependence and is newly in recovery, which of the following is most likely to aid in the treatment process? A. Acamprosate, Camprol. B. Bupropion, Wellbutrin. C. Buprenorphine, Buprenex. D. Varenicline, Chantix. The correct answer is C. Buprenorphine, Buprenex. Buprenorphine is indicated for treatment of opioid dependence. Augmentation with behavioral, educational, and/or supportive therapy in groups or as individuals is probably key to successful treatment. The psychiatric mental health nurse practitioner evaluates a 3-year-old male and makes the diagnosis of attention deficit disorder. Following the Food and Drug Administration's labeling of approved medication for children, which medication can be started in a child at age 3? A. Fluoxetine. B. Amphetamines. C. Methylphenidate. D. Bupropion. The correct answer is B. Amphetamines. Only amphetamines are approved in children ages 3 and older. Methylphenidate and guanfacine are approved in ages 6 and older. Fluoxetine and bupropion are not approved under the age of 8. After 2 weeks of treating a client for psychosis, the client develops symptoms of neuroleptic malignant syndrome, NMS. The following factors enable the psychiatric mental health nurse practitioner to differentiate NMS from serotonin syndrome. A. Autonomic instability, diaphoresis, tremors. B. Rigidity, hyperreflexia, orthostatic hypotension. C. Hyperthermia, leukopenia, tachycardia. D. Mutism, leukocytosis, myoglobinuria. The correct answer is D. Mutism, leukocytosis, myoglobinuria. NMS can be differentiated from serotonin syndrome by the presence of mutism, leukocytosis, dysphagia, and laboratory evidence of muscle injury, that is, elevated CPK, myoglobinuria, or rhabdomyolysis. Which is the only medication that is approved by the U.S. Food and Drug Administration, FDA, to treat depression in children? A. Fluoxetine, Prozac. B. Paroxetine, Paxil. C. Sertraline, Zoloft. D. Citalopram, Celexa. The correct answer is A. Fluoxetine, Prozac. Fluoxetine, Prozac, is the only SSRI medication to have FDA approval for the treatment of major depression in children and adolescents. A pervasive pattern of grandiosity, lack of empathy, and need for admiration suggests the diagnosis of which of the following personality disorders? A. Narcissistic. B. Paranoid. C. Borderline. D. Schizotypal. The correct answer is A. Narcissistic. The essentials features of narcissistic personality disorder is a pervasive pattern of grandiosity, need for admiration, and lack of empathy that begins by early adulthood and is present in a variety of contexts. You are seeing a client for an initial psychiatric evaluation. The client complains of persistent irritability, racing thoughts, decreased need for sleep, distractibility, episodes of unusually high energy, and auditory hallucinations. The episodes of disturbed mood last approximately 5 days and the psychotic symptoms occur even if mood is euthymic. The most likely diagnosis is A. Schizoaffective disorder bipolar type. B. Bipolar I disorder with psychotic features. C. Bipolar II disorder with psychotic features. D. Schizophrenia. The correct answer is A. Schizoaffective disorder bipolar type. Schizoaffective disorder bipolar type. In schizoaffective disorder, the psychotic symptoms usually continue in the absence of prominent mood symptoms. You are seeing a female patient who is morbidly obese. She also suffers from major depression, anxiety, and antidepressant-induced decreased libido. She has been stabilized on desvenlafaxine, Pristic, 50 mg 1 orally every morning, and bupropion, Wellbutrin, 50 mg. She also takes Mononessa, orthocycline, 1 orally every morning, and vitamin D 1000 international units orally every morning. She has had trouble maintaining weight loss on diet support programs, diet medication, and self-directed food reduction plans. She asks about using phentermine to lose weight. You discuss the options with her and decide to A. Prescribe a 1-month course of phentermine, Adipex P, 37.5 mg orally every morning. Have her come back in 1 month for a checkup. B. Prescribe a 1-month course of phentermine and topiramate, Simia, 7.5/46 for 30 days. Have her return to the clinic in 1 month for a checkup. C. Discontinue her current bupropion. Prescribe bupropion and naltrexone, Contrave, 90 mg over 8 mg for 1 week. Have her come back in 1 week for a checkup. You may have to increase the dosage at 1-week intervals. The correct answer is C. Discontinue her current bupropion. Prescribe bupropion and naltrexone, Contrave, 90 mg over 8 mg for 1 week. Have her come back in 1 week for a checkup. You may have to increase the dosage at 1-week intervals. Naloxone should be added to the bupropion to extend cravings for food by increasing the activity of the pro-opiomelanocortin neuron associated with appetite control. A patient is followed by the psychiatric mental health nurse practitioner psychotherapist and states, "I went to see my primary care provider, and she told me my liver is working harder than it should and she thinks it might be due to my drinking. I don't think I have a drinking problem, but I don't want to have any health problems either. Can you give me the names of where Alcoholics Anonymous groups are located?" I told her I would try and cut back a bit. What state of readiness to change is shown? A. Pre-contemplation. B. Contemplation. C. Preparation. D. Action. The correct answer is C. Preparation. This patient has identified a problem and is getting ready to change, which is the preparation stage of change. Sam, a 6-year-old female, presents with her mother for a new psychiatric evaluation. Her mother reports that Sam is not making friends at school, stays by herself, will not read aloud in class, and requests adult reassurance before making a decision. Which stage of Erickson's stages of development is Sam having difficulty mastering? A. Trust versus mistrust. B. Intimacy versus isolation. C. Identity versus role confusion. D. Industry versus inferiority. The correct answer is D. Industry versus inferiority. A child between 5 and 13 years old is working toward learning new skills and taking pride in those new skills, pleasure and boundaries, which is Erickson's industry versus inferiority stage. The risk of being overly empathetic as a therapist is commonly characterized by which of the following responses by the client? A. Reenacted attachment with dependency and acting out. B. Reenacted attachment with merger and fusion. C. Reenacted attachment with alienation and isolation. D. Reenacted attachment with understanding and change. The correct answer is A. Reenacted attachment with dependency and acting out. Dependency often forms as a result of parents' genuine affection, extreme attachment, and overprotection. Being overly empathetic as a therapist can foster transference and dependency. This can be followed by acting out to push away from the dependent attachment on the therapist. Attachment relationships between infant and mother are considered critical by neurobehavioral researchers because A. The mother functions as a regulator of the social and emotional environment. B. Interaction influences development of the brain's limbic system. C. Attachment to significant relationships facilitates self-regulation of emotions. D. Subtle emotional regulatory interactions can transiently or permanently alter brain activity levels. The correct answer is C. Attachment to significant relationships facilitates self-regulation of emotions. Self-regulation of emotions is an emotional skill that develops through attachment to significant relationships and continues to develop through childhood and adolescence. Johnny, an 8-year-old male, presents with his foster mother for an initial evaluation. When interviewing the foster mother alone, it is confirmed that Johnny was taken out of his home due to sexual abuse by his stepfather. As the treating psychiatric mental health nurse practitioner, you know which of the following are evidence-based treatments for Johnny. A. Family therapy. B. Trauma-focused cognitive behavioral therapy. C. Behavioral therapy. D. Interpersonal therapy. The correct answer is B. Trauma-focused cognitive behavioral therapy. Trauma-focused cognitive behavioral therapy is the minimum standard of therapy for a child with a history of trauma. Psychotherapy, which stresses the importance of recognizing patterns of thoughts and how thoughts influence feelings and behaviors, best describes A. Group therapy. B. Cognitive behavioral therapy. C. Supportive therapy. D. Family therapy. The correct answer is B. Cognitive behavioral therapy. Cognitive behavioral therapy posits that by learning how thoughts and behaviors influence our feelings, we can learn to have more control over our feelings. When screening potential female clients for an incest survivors group, which client would you exclude from selection to the group? A. 50-year-old third-grade teacher who last attended a sexual abuse group when flashbacks recurred. B. 18-year-old college freshman who is talking openly about her incest experience for the first time. C. 26-year-old new mother inquiring because her husband is concerned about her lack of interest in sex. D. 36-year-old divorcee who brings a signed consent form to consult with her individual therapist. The correct answer is C. 26-year-old new mother inquiring because her husband is concerned about her lack of interest in sex. Exploring individual issues and couples' relationship issues before entering any group therapy experience, particularly an incest survivors group. A child who is seen by the psychiatric mental health nurse practitioner has difficulty feeling safe with his caregiver and is unable to feel comfort. Which theorist's theory would help explain the child's behavior and help guide treatment? A. Bowlby. B. Bowen. C. Erikson. D. Freud. The correct answer is A. Bowlby. According to Bowlby and attachment theory, children who come from parents with high expressed emotion and unresolved losses tend to develop disorganized attachment, characterized by not feeling safe with their caregiver and an inability to feel soothing comfort. The following scenario is an example of the defense mechanism sublimation. A. An employee is embarrassed by a boss at work and angrily cuts a driver off on the way home. B. A group therapy client strongly dislikes another member but claims that it is the member who dislikes her. C. A host despises one of the party guests yet greets him warmly and offers him food, beverages, and special attention. D. A mother of a child killed in a drive-by shooting becomes involved in legislative change for gun laws and gun violence. The correct answer is D. A mother of a child killed in a drive-by shooting becomes involved in legislative change for gun laws and gun violence. Sublimation is redirecting unacceptable feelings into an acceptable channel. Cognitive behavioral therapy, CBT, is often one of the first-line treatments for anorexia nervosa. One of the primary goals of CBT is to assist the patient in which of the following ways? A. Resolve symptoms of depression. B. Improve interpersonal relationships. C. Restore weight above 85% of normal. D. Overcome distorted thinking. The correct answer is D. Overcome distorted thinking. CBT teaches patients to identify, evaluates, and respond to their dysfunctional thoughts and beliefs. In co-leading a group of elementary children of divorcing parents, a child shared that his parents were arguing over the weekend and calling each other names. What is the most appropriate intervention at this juncture? A. Ask the child how he was affected by the incident and facilitate sharing of similar incidents by other children. B. Ask the child how he was affected by the incident and ask other children how they handle similar situations. C. Allow the child to finish describing the situation and then ask how he felt about hearing this argument. D. Ask the other children in the group if they experienced similar situations and how they handled their feelings. The correct answer is B. Ask the child how he was affected by the incident and ask other children how they handle similar situations. Self-disclosure. Use judgment as to the appropriateness of letting a child go into detail about personal matters in a group. In an elementary school group, you may not want to let a child go into detail about a parental fight. An important intervention is directing the child to express how he was affected by the incident. In working with elderly residents at a nursing home, the goals of reminiscence groups include all of the following except A. Improve cognitive function. B. Facilitate life review. C. Maintain self-esteem. D. Reduce wandering. The correct answer is D. Reduce wandering. Reminiscence is the thinking about or relating of past experiences, which encourages elderly residents to discuss their past and review their lives. It helps maintain self-esteem, stimulate thinking, and support the natural healing process of life review. Activities that facilitate reminiscence include writing an account of past events, explaining pictures in old family albums, and sharing stories about a particular theme or life event. An adult female client who has been a full-time homemaker raising 4 children finds herself sad, regretful, sleeping late into the day, and generally fatigued since her youngest child left for college. What theoretical framework is most appropriate in the psychiatric and mental health nurse practitioner's appraisal of this situation? A. Maslow's hierarchy of needs. B. Mead's role and gender theory. C. Erikson's 8 stages of psychosocial development. D. Family life cycle. The correct answer is D. Family life cycle. The empty nest is a normal turning point in the family life cycle, with normal tasks such as renegotiation of the marital system, development of adult-adult relationships, realignment of relationships, and dealing with disabilities and death. As a psychiatric mental health nurse practitioner using family systems theory, you know that families seek equilibrium in the face of change. This is an example of which concept? A. Morphostasis. B. Homeostasis. C. Homeogenesis. D. Morphogenesis. The correct answer is B. Homeostasis. The essence of family homeostasis is that families seek equilibrium. Understanding normal growth and development. At what age should a child use up to 1,000 words, use 3 to 4 word sentences, balance on one foot, and play make-believe? A. 2 years of age. B. 5 years of age. C. 4 years of age. D. 3 years of age. The correct answer is D. 3 years of age. The language and nonverbal development of a child at age 3 consists of the following: speaks up to 1,000 words, uses 3 to 4 word sentences, follows 2-step commands, speech is understood by family, plays make-believe, balances on one foot and briefly shares toys.